Hi, everybody. This is Susan Clinton with my partner, Erica Mello, and welcome to Tough to Treat. This is episode number 157. And I just wanted to pop in and wish everybody a happy spring. This episode is going to be really fun for you all to listen to. We're actually taking Erica's famous foot progression that you've heard about in several episodes. And in fact, we featured in one episode for sure, just the progression. We're going to take it into a pre-progression in this particular episode. So I just wanted to direct everybody into our website, www.toughtotreat.com. Sign in for our opt-ins, get on our list. That's where you find out all the good stuff that's going on around the podcast. So enjoy the podcast. Thank you. Hello, everyone. Welcome to Tough to Treat. I'm Susan Clinton, your co-host, and I'm here with Erica Mello. How are you, Erica?
I am fine, Susan. How are you?
Very good.
I was just remarking how windy it is here today. We've been so if you're listening to this when it comes out, a few days ago we had 89 degrees and now we have 50 and I was completely underdressed. So we went almost 40-degree variation in 2 days, right? It's crazy.
Yes, it does happen. It does happen. We're in northern Michigan, the Upper Peninsula up here, and we're having snow squalls today. I know everybody keeps wondering about that. It's like we have a very late spring here.
Yes.
Daffodils and tulips are about 3 inches out of the ground. So May is our spring flower month.
Spring flower,
yeah. When the bulbs come up, and then we can start planting flowers in June. So we're looking forward to it.
Yeah, we've got the tulip. Everything's up here in New York, but it's massively windy, and it was just I was just not prepared for 89 degrees in, the beginning of April. So not mentally or physically.
So today we're going to do something a little bit different. We'll drop the episode link along with the podcast into, wherever you watch or listen to podcasts. So you'll have the link to the previous episode, but Erica and I have talked about foot progression for a long time. Feet as a driver, ways to get the foot more active, ways to, balance the body and the foot and the thorax. We've gone through this several times, but in a conglomeration of clients and things that I've had, I wanted to take us back one step into like a pre-foot progression.
Like a prequel.
Yeah, like a prequel to the foot progression. That's exactly what it is. Or foot progression 2.0. Like before we get into the foot progression, you first have to do the following.
Yeah.
But anyway, it's just kind of, I think it'll be just a little bit fun to kind of imagine and think about and give people some ways to look at, the foot as a driver, or the foot as a lack of participation in the, and how that it can be a driver without being stiff. A very squishy foot can also be very much a driver. It's just not one that we think about being held stiff that we need to change and do all of this stuff to. So we're going to just take a look at this, but I'm hoping it'll help people identify when, sometimes feet can be a little bit of an issue in this. So we're going to basically do standing, but at the end, maybe you and I can brainstorm a few things in, quadruped and half kneeling and stuff that we've talked about before that can help as well. So thinking about the foot and the pelvis is kind of where I'm going with this, because if the foot is driving the pelvis a bit, we want to just kind of think of a couple of things. So remember that the muscles around the pelvis are going to be generally L5 to S2.
Yes.
That's the glutes, that's the hip external rotators, and that's going to be a piece of the pelvic floor. The pelvic floor, of course, has S3 and S4. As well as part of it, but you certainly are going to be getting a general amount of muscular innervation from that segment. And that's the same segment that goes down the back of the leg and onto the underside of the foot.
Yes.
So there's a connection sensory, there's a connection, through that dermatomal sensory piece. There's a fascial connection, of course. And then there's also the muscular, the muscle and nerve connection that happens. So we get sprouting off of the long tracking nerves into the pelvis, and then those long tracking nerves go down, hamstring, gastroc, and definitely into the foot muscles, which is really important because we think of the foot as just, we forget about foot activation of those muscles and think about, is the foot just sitting on the ground wrong? Is it standing on one side? Is it collapsed? What's going on there? But I know you have talked a lot about activating the foot and getting the foot in a different position so that it can activate differently, and how that can influence all the way up through the thorax and the cervical spine.
Yeah.
So we want to think about, just we're going to kind of start this story off looking at the plantar surface of the foot muscles in standing and kind of what's happening there. And when the feet aren't active. So when the feet aren't active, one of the things that I have seen over and over and over again is there's an effort there's an effect that comes from that. When the feet aren't active, the body tends to lean backwards. And when that happens, in order to keep from falling down, we tend to kind of jut the pelvis forward. And then the thorax goes backward and the head goes forward. So we kind of are already set up for an inefficient takeoff if we're going to start walking, because we're too far behind our center of gravity. And so it's ineffective at that point. And when you ask somebody who's standing in that kind of posture to actually lift and move their toes, one of the things that I've noticed is that they lean back more and there's a lot more quad activity. Kind of like lift something up so that their feet, their toes will be released. Even though they're standing kind of on a squishy way, because they're standing back. They have to use all this quad strategy to get their feet to activate in some way. Which is interesting because that activates the quads and it shuts down the posterior lateral chain. So in other words, the glute muscles don't need to work in that position because they're not in a position to fire under gravity. And the lateral chain doesn't need to work, but the anterior chain overworks. We get into some ab gripping and, quadricep gripping. And it also kind of puts our pelvis and our anterior pelvis into kind of an interesting position, because if you think about just joints and joint mobility and joint mechanics, kind of along the line of Shirley Sarman, and you think about kind of just a forward migration of that femoral head in the acetabulum.
So it's almost like the one link in the chain kind of goes awry and the rest of it kind of goes along with it, so to speak.
Right, which makes it a little bit more inefficient for hip flexion, to occur, because we're already in an anterior moment there. And so that's already a problem. But then we want to kind of flip and think about a rigid foot. And what really happens with the rigid foot is going to be that shock attenuation issue. Because the muscles aren't working in a squishy foot, but they're also not working in a rigid foot because they don't have to. So the idea here is like, how do we get the foot to turn on and to work? Any thoughts you have right there before I slide into my next piece?
So the only thing I would say is that I think sometimes, and we've talked about this, is we tend to look at the center of mass more medial lateral, right? And I also look at AP. I actually do the put your hand on the manubrial sternal junction and your other hand on the top of the pubic symphysis, and I actually look at that because that for me is a marker, just a marker, and the patient does it. And so those AP relationships are very important, especially when you see someone's center of mass so far back. Or I had a patient who was so far forward, I thought she was going to tip over, and she had foot pain and calf pain. I'm like, no wonder you're practically falling over. And that was obvious from a side view, not from a posterior or an anterior view. So I think those AP relationships are very important, because remember, the pelvis and the thorax are 360. They're not 180, they're 360. So there you go. Those are my thoughts.
And I think that's important, that you bring up some of the foot pain, because some of the strategies I see with heel pain, is that they don't want to be on the back of their feet, but they are on the back of their feet. They say, well, I don't want to do anything that's going to make me put pressure on my heel. And it's like, you're already standing on your heels. But they develop some sort of a, kind of posture that puts them over on the outside of their feet, or if the outside of their feet bother them, puts them to the inside of their feet. And that is all driven by what's going on up above, to just try, so they tighten up and they clamp down lumbar spine, they clamp down quads and things like that, because the pain experience, of course, makes us overcook.
Yeah. And I also think that when I've seen the foot is the main or the primary driver, yes, you have a lot of grip muscles that are gripping, but there are also some other muscles that are not working at all.
Right.
And it, like any region of the body, right? And I do think that it also depends on whether, I'll just use a split squat as an example, because when your foot's behind you, it's a different control mechanism than when your foot's in front of you, right? And so those two, I think, are two very important distinctions to be made when you're looking at trying to control the foot.
Yes,
So
and thank you for bringing that up, because we're going to move into a couple of activities to help begin to get the foot as a player. And part of it is going to be working that person into stride, which would be the precursor to split squat.
Right.
Which would be a much more advanced type of work for the foot.
Yes.
But we got to get them there, and
the pre-work. Yes.
Yeah. So this is, again, the prequel.
Yes.
So one of the things that I do, we're just going to go off of the foot that tends to be a little bit non-active and squishy.
Okay.
All right. For lack of a better word, I don't like to talk about a pronated foot, because a pronated foot could be quite rigid. I'm talking about a foot that's just kind of
poorly
collapsed onto the ground, and it's loose and it's squishy, but it's very movable. So thinking about the first thing that I like to do with people, and you talk a lot about positioning the talus and the calcaneus and getting that set onto the floor. And certainly that's a great technique to use there if they can't create the tripod without some input.
Right.
So the idea here, first of all, is to create the tripod of the foot, which means pressure underneath the heel and pressure underneath the fifth and first metatarsals. So we have to get those pressures there. And that means they're going to have to make some, in order to do that, they've got to sway back over their feet. Or in the case of the person you were talking about, they got to sway back a little bit. So they have to get positioned over their feet, which means their thorax is going to have to come and get positioned over their pelvis a little bit. So I always feel like a foot driver needs some help, so we can do what you do with that you and I talk about. It's not just you doing it, but us talking about it. You can influence that from the foot by getting right over the talo, crural joint in the front. And just playing with the talus and helping with the calcaneus in the back. If they can't, get the, just so they can feel the position, then they can start to get it themselves.
Yes.
Or you could even come up into the thorax and just help the thorax kind of just get balanced over the pelvis and bring them forward a little bit.
Yes.
See what happens. Can the foot accept that and get into a tripod position?
Yes. Can it
so
adapt?
The beginning of this is just really establishing the tripod. Not an overactive foot, not an underactive foot. Can we establish the tripod?
Can we center the center of mass over the base?
And then will everything start to change and line up, and get that going? So we want to be able to do that and decrease the quad gripping and the ab gripping that's going on, because they no longer need those muscles to overwork now if they're under gravity in a little bit of a different position.
Yeah.
Once they have the tripod, the next step is to add sway. So before we go into heel lifts and all the other pieces that we need to do, for a good strong foot, is we want to just get started with sway. Can they move back and forth from that around on that tripod?
AP
sway. Lateral, circular, I always start with AP, because that seems to me to be where they're lacking the most.
Yes.
They're either into too much hip extension and thoracic flexion and forward head, or they're locked down, with hip flexion a little bit or something else. So I want to really change that AP or that sagittal plane a little bit more. But the idea here is to get them into tripod. Be sure they can get themselves into tripod and they can stack up over the tripod. But again, this is not like we build everything off of a neutral foot. It's just a starting point, because immediately we're going to go into sway, because nobody stays in one position longer than a nanosecond.
Right.
So get into that position and then begin to add some sway. Now, here's the fun thing that I like to do with it is once I get them to sway just a little bit at the ankles, all ankle strategy, and not using their upper body to sway, we want to start thinking about as they sway around, can they keep their toes long? And can they gently move them during sway? So if they begin to sway backwards, do their toes curl into the ground? Or if they sway forward, do their toes curl into the ground? Like, oh, we haven't been there before. We don't want to go there. And can they learn to like let those toes go so that they're really working over the tripod?
Yeah.
And the toes can lightly bounce along on the floor for kind of input, proprioception, balance, but not have to become a weight-bearing lever at this point.
Yes, yes. And I think it's interesting too, because when you have people do that who are so far forward or backwards, they will start gripping. I mean, but it'll be interesting to see if they can actually use the appropriate muscles 360 in the rest of their body to keep them stacked versus just doing like a hip hinge, or it's very telling when you have somebody do that, because if they can cheat, they will do it. And it'll be obvious to your eye when you see that.
So if you have people who have difficulty doing this activity, the thing to consider doing is put their hands on the wall, put their hands on the back of a chair, put their hands on a countertop, put their hands on some walking sticks, and give them a little input into their system, because they may be lacking some stability.
Yeah.
And so if you've got somebody who's either pretty rigid and is afraid to let go, or somebody who's kind of hypermobile and uses these positions, this forward, hip, this leaning on ligaments to maintain their upright posture, it can be something that they might have trouble working with. So you can add the arm, the input from the upper body in, and keep working on the ideas like coming from a softer foot to get into tripod and being able to sway, but be able to keep the toes not curled or jammed into the ground. Yeah, we want nice long toes that as they go forward, the toes actually splay a little bit, because they have to do that when the heel comes up.
Yes.
Because if they don't, they're not going to get heel rise, because the toes are curling or pressing into the ground. It's going to prevent that heel from rising as efficiently as it should. So the toe should actually splay out to give a wider base of support for heel rise. So thinking about that and keeping that in there, and that can be an exercise that they go home with for a while. They come back, they test it, they get better at it. But having their hands on like a countertop or the wall or some hiking sticks or even the back of a chair, whatever they have, helps them really kind of feel a little bit more what's going on in their feet, because they're not worrying about falling over. They're able to feel the tension in their feet and just learn to kind of change that a little bit motorically.
Yeah. And I think sometimes, like at least from my personal experience, is if I just give somebody a ball release for the bottom of their foot, and they'll do it for like a few minutes, the minute that ball comes off, they're like, oh, I can feel my 5 toes on the ground. That's the kind of feeling you want to have and maintain when you're trying to do the exercise that Susan just described.
Yeah. So, and there's so many ways to mobilize, and just bring attention and input to the bottom of the foot.
Yeah.
The ball is one of them. They can sit and run their foot over the ball. They can sit and cross their leg and take a ball and rub it on the bottom of their foot.
Yes.
You can do mobilization. You can teach them to do mobilization with a towel underneath their arch and moving it both directions underneath the ball of their foot, the metatarsals, and moving it in both directions, flexing the toes over and lifting them up. Same with TheraBand. All of those things. Maybe a nice precursor to this exercise is if they have neural tension, to do some of those sliders and gliders with the long tracking nerves in the seated position, and or bend over, with knees relaxing and lifting and head down, and all of those things to do are really good. But this is kind of taking you into what we really want to have happen, which is now the body's prepared to do this work. We want to be able to make sure that they can do it. So if they can't feel it, they can't get into tripod in the beginning, then you can do those things to help them. You can either set their foot, you can do the work on the ball, you can mobilize, they can mobilize, teach them to do those things so that they get a lot of input to the thing. A lot of people will just say just rubbing the bottom of their foot with your palm, or them rubbing their own feet can wake up the system just a little bit so that they have some input and they know what they're feeling. I have a client just recently who we have gotten, a little deeper into what's going on. And one of the things she says, when things are really bad with her heel pain, that she knows her toes are really stuck to the ground because she's learning to feel this a little bit differently now.
Yeah.
And she said, and actually my toes go numb. That's a neural tension issue.
Yes.
That's a real neural tension issue. So this kind of work would go along with doing the neural tension work as well. And, kind of decreasing the protective threat and working with activity, changing and things like that to keep, to bring the system out of that rigid locked posture up above and to allow some of that grace and mobility below, of which is threatening to people with pain.
Yeah.
Because they're used to only staying in one position because they can control it that way.
Yes.
It's like, oh, if I start moving, it's threat that feels threatful. So we have to this is a nice way to help them work through that and breathe through it and feel safe while they're working on it, which is why hands on the wall, hands on the chair, hands on things they may be resistant to because they want to just push through. And it's like, no, it's really important that we really change the motor behavior here so that we can actually take you into some things that will work better for you, so that if the toes don't go long, if they can't get into a tripod with long toes as they sway forward, they're going to have more trouble lifting their heel up. And moving into the exercises that you have talked about with heel up, knees bent, knees straight, heel down, that progression. That's
swing squats.
That's so lovely for people to do. That really helps them increase the power and efficiency of how their foot works. So once they get this, then you can have them work on leaning forward, and just so they develop a little bit more of the tripod and some activity just before heel lift. So now it's kind of a matter of, can we go a little far forward, hands on the wall or on the chair, wherever, or even without, if they can do it without, to where they just almost feel that heel lift up. And then can they come back and get back into tripod and or relax their feet a little bit. And then the same thing. So they can do that forward sway, maintaining tripod. Don't roll off on the side of your feet. Don't collapse inside. Don't let one foot do one thing and the other foot do another, but kind of center themselves in work. But just so that they're getting right to that point. And that's critical then for them to be able to feel those toes splay out just a little bit. Because most people, when we start to do that, are going to tend to press those toes into the floor in anticipation of we're going to be working now, and the muscles and the fascia are pulling in that windlass effect that happens there underneath the foot.
Because I'm thinking, because I have foot issues, and I'm thinking I would see myself going forward, and I have a gripping strategy anyway, just at rest, and so when I go forward, I could just I'm sitting right now and I can feel my toes wanting to grip, and that's a really good exercise to do. Because it's got to be a precursor to a heel lift. You need to splay to lift that heel up off the ground. Right. And
I'm not talking about splaying and rolling toes in all different directions, but just kind of, it's almost like just reaching out and, so that there's more of the toe on the ground. To be able for the heel. That you're actually the balls of the feet aren't doing all the work or trying to push back these toes that are curling underneath. There's no lengthening there. So teaching that foot to lengthen as it moves into a shortened position, which is a little tricky because it needs to work, but the toes don't need to work along with the intrinsic muscles of the feet. Remember that they have long tendons going to them. And so we want to be able to have two different things going on. We want the stability of the foot to come in, but we want the foot and the ball of the foot, that flexion, the MTP flexion to occur in order for them to be able to roll forward onto their heel as they walk.
Especially as they're standing and they're moving their entire center of mass forward. It's, you're going to need those long muscles of the calf and to work more than the intrinsics, the shorter muscles of the foot.
So it's kind of working from a softer foot to tripod to foot activation with toe lengthening to lift a heel up as we kind of work. And so now what do? Now you can move them into, which is why I love that you talked about split squat, to kind of do like just a test. Can they control that? If not, we may have to go and see, go through this little pattern here and see where they're losing it or not, or they're losing control. So now we take this and we take them into stride. And, so now they can put two hands on the side, on like two chairs next to them, or the two poles, if there's room on the wall. I just don't want them kind of leaning forward funky on the wall in stride. Sometimes they can stand with one hand on the wall in stride, with the hand to the side. You just have to set it up and see what makes them feel safe. And so now as one foot begins to have to get active to move into like heel raise the back foot, then the front foot needs to be moving into tripod for acceptance.
Exactly.
And so you can kind of work back and forth. Now the brain has to pay attention to what the front foot is doing.
Both.
And making sure the toes aren't curling in the front, making sure the toes aren't curling in the back, but there's enough activity and control that heel could almost just lift so they can practice that swaying.
So you're saying doing a sway in the split squat position. I love it. In a stride stance. Yep.
In a stride stance, which I think is really functional to move into, lunge.
Yeah.
Split squat, bending over, squat, even just, all of that, but it makes the feet work. And you can really, if they have one problem, if the problem is more on one side, it's really nice because you can put the feet in both positions, and really they have to learn how to use that foot control, in that thing in either being the back foot or the front foot. And the other foot, you don't want it to take over and do it all.
Yes.
You can balance them a little bit more between their feet so that they can have that. And so then, of course, you can, and then, the next part of that is like, how do you progress that? So now are we ready to like start to lift the heel up, and do it. So, and we're already in these great positions that you start them off in, which is hands on the wall and doing it. I like the idea of, when they're standing in stride to go ahead and transfer your weight all the way to the front foot.
Like a step forward.
Transfer your weight to the front foot. Now transfer it back and transfer it. And then you can start with feet together, moving forward, stepping forward, and can all of that be maintained? What's happening at the heel in the back? Is it wiggling inside or outside? Are they rolling onto the side of their foot as they step forward onto it? Are they rolling inside to their foot? What's really going on there? What do you need to do? Do you need to back it up a little bit? Was it too much? Is it too far? And when they can get that control in there, working on those things, I believe then they're ready to really start doing the foot sequencing that you talk about with the because it strengthens their feet and different positions, and it makes them have to motorically change what their feet are doing, whether the knees are bent and they're raising up, or the knees are straight and they're raising up, or the knees are bent and they're coming down, or the knees are straight and they're coming down.
It's interesting because as an aside, I had a patient today who I was progressing him to a split squat, and he's like, well, I do Bulgarian split squats. I'm like, we're not going to have that. Okay. We're going to because he puts the back leg on like the weight bench, and then he squats down, and I'm like, oh, no. So I said, just show me a split squat. He could not, the form was not good. So I had him on the hands on the wall, and I said, and he's a thoracic driver. His thorax is his driver. So I said, hands on the wall, and he had him in a sort of a narrowish base. He had a hard time with the split squat. And so I said, move your hands wide, so for the listeners, just, if there's another driver present, just play with that. But, hands wide. And then he got the split squat because the use of the wall is great reference for center. I took him off the wall. His brain had learned very quickly. And so within like 5 minutes, he was getting the split squat down. But don't assume people know how to do these things, because trust me, this guy's an avid weightlifter. He could not do a straight split squat off the wall at all to begin with. He was doing Bulgarians, and it was just it was too much to start with.
Right. And so I think some of the fun things that we can do once you can get this to happen is then you can take them into kneeling, tall kneeling and half kneeling, or even quadruped, and tuck their toes underneath them and see what their feet are doing as they move around their body, with the toes tucked underneath, are they able to maintain this nice strong foot, in half kneeling as they move their arms around,
Yes.
or as they turn their trunk side to side, is that leg and foot flopping around, or is it staying in a kind of a nice position where the foot can control, the leg and the leg position on the floor.
Yeah.
And the same in tall kneeling. It's harder for them to go into, unless they're extremely flexible, to go into, that hip hyperextension in tall kneeling, because most of the time these people have
Yeah.
tight quads,
Yep.
and because of the overgripping of their quads. So you get them into tall kneeling, you tuck their toes underneath them, and then they have to work on, can they move their pelvis forward and back? What happens to the feet is they start to move the pelvis. Remember the shared neurology.
Yep.
They're still going to be caught in a circuit. Can the feet now stay still and control while the pelvis learns to, like, can I go forward? Can I come back? What do I need to do over these hip joints to be in this position? And same thing in half kneeling. If they can't do tall kneeling first, you start them in half kneeling and then work them back into tall kneeling. And those can be some really nice ways to do. And then of course, quadruped, they're, just, can they bring their hips back to their feet, and can they, go forward? And, how are their feet handling that? Are they rolling off? Are they, is the foot control bad? Is the foot control good? What's happening there as the pelvis moves, and basically a sagittal plane is just inverted in quadruped.
Yeah, and I also like that one. I do like a modified down dog as well. I just have them bend their knees. Yeah, so that's another progression. But yeah, but you can also weight shift as well in all these positions, and I think that's a good way to do that, especially if you're in a down dog position. But that's a much harder progression.
And and so one of the things that's a lot of fun to do is when if you want to make it a little dynamic for the feet, you can put them over a Swiss ball, and then of course, prone on a Swiss ball, and then get their feet underneath them, and they roll forward till their toes, till they have to lift the back of their feet up. You can do that on one leg, on both legs. You can have them, be on their toes with their heels off the ground and walk their feet around. And can they control the front part of that tripod? Can they sink back onto their feet? So talk about modified downward dog. It's kind of great because they can use the ball to roll to help them in the beginning till they can gain control and strengthen their feet to actually do that downward dog better.
Yeah.
Without the ball, because that takes a lot of strength. That's like a modified plank in a way.
Exactly.
So that require, and if they don't have the power in their foot to control, sometimes it's why people end up with wrist and upper body problems with those types of movements, because there's not enough control of the lower part to balance the pressures, the weight bearing pressures out. So the wrists take all of it, or the shoulders, or there's something else takes more than it needs to take, because the feet aren't doing what they should be and could be doing to help really balance and control that.
Yeah. And I think also, we need to think about what the impairment is. And a lot of times, and we have often talked about, we need to build volume at low levels. And a lot of these pre-exercises are setting the foundation. I know we talk about doing seated heel raises, and I kind of start with that sometimes, but getting the full body and checking the AP relationship, because of a lot of people do have these issues. AP, they're just not looked at often, I think, and they should be. And just getting that movement or that strategy ingrained in the brain first, it'll make the other exercises easier, I believe.
Yeah 100%.
Yeah, I believe
100%.
Yeah.
So anyway, play with this in the clinic, see what you find, leave us your comments, tell us,
a good one.
Tell us what you feel like helped, what you feel like you still need, but the biggest thing is get a little creative with it. And see what you can do to cue. And do you need your hand to cue? You might. Can you cue with, TheraBand? what can you cue with, that can help them, gain this ability to really control feet, which helps them with pelvic control
Yeah,
quite a bit.
yeah, no, I agree. I often get on my hands, and I mean I'm on the floor a lot in the clinic with my hands, and I train with my, like, I'm like putting my hands on their feet just in the clinic. But I think that, using, and obviously I'm not going home with them, so having them play around and be creative like you suggested it's great, because we're so quick to jump to hard exercises, as
Yes.
a profession. And we need to step back and say, okay, what needs to happen first? And I like the word of pre, because that is something that is a good basis and a foundation. So, which we all need,
Mm-hmm.
and I've often found when I'm on the floor, because I have footish dysfunction, my feet cramp up a lot when I'm on the floor, and that's another issue. But it's a very common problem for patients. And so, as Susan said, have a go with this, and let us know, and in the comments, on our Instagram, or email us, or wherever. We would love to hear from you on what works, what hasn't worked, if there's anything you need from us in terms of good topics for the podcast. No, while we're at it, we might as well ask that, right?
Yeah,
Because we have a
exactly.
lot of topics, but we're always willing to obviously listen to our listeners. So
100%. And just for those of you who are listening, some of the best ways to get in touch with us is if you have a question about the podcast. Sometimes we don't always get those picked up through the website, which we did, but we don't. Somebody had a question about slides, and I have not been able to email them back.
Yeah.
So Susan at ltiphysio.com and Erica at ericamello.com. It's a good way to pop in and give us a question, drop in and tell us what you want to see or hear about. And we'll talk a little bit more about the foot, and particularly the pelvic floor. I'm going to pop in with some nice little pearls on one of our shorty podcasts coming up soon.
Awesome.
All right. Thank you,
everybody.
everyone.